What's going on, moms and dads? My name is Dr. John Caruso. I am a nervous system focused pediatric prenatal family wellness chiropractor in Katy, Texas. And I got an important question for you. What is the absolute most important nerve within our entire body? Now, I promise that this is not a trick question, and we're not going to get into all of the holiday trivia that we just finished up with all the relatives last month. But most of us, especially within health and wellness, even some of the medical spaces, we would all agree that the vagus nerve is the most important for just a few reasons. And it's not because it's the longest nerve within our whole entire body and that its branches, stem from the brain to the digestive tract. The main reason is that it plays such a crucial role in the function of our autonomic nervous system. If you remember from our last video, that's the part of the nervous system that controls all the automatic functions. So like our breathing, our heart rate, our digesting of food, our pooping, and sleep. The things that we just can't consciously control that happen without us thinking about it, right? So when we talk about our vagus nerve, it extends from the brainstem, so the base of the skull, all the way down to a bunch of various organs within the body. So our heart, our lungs, the digestive tract. There's a bunch of sensory components to it as well. And so the vagus nerve is responsible for regulating these essential bodily functions like our heart rate and digestion and breathing. And so it's also influential, and this is one of my favorite pieces of the vagus nerve. It's very influential in emotional regulation, socialization, cognitive processes, and it actually influences gut inflammation and the immune system. So it's kind of a big stinking deal. And so when we start thinking and really diving deeper into the vagus nerve, it's been up until fairly recently that researchers have really started to unravel its functions. And so what's happened is they started uncovering the layers of its contribution to our physiological but also our psychological well-being. And so our vagus nerve acts as a vital link between the brain and the body, and it's absolutely tied to many health challenges, especially when it comes to our emotions, our growth, and development, especially for children. And so, plus, thinking about it as parents, we know that so many of these challenges that our children work through are tied together. So, digestion and our immune system, and then behavior and emotions. The vagus nerve is exactly what causes the perfect storm of struggles to come together within our kiddos. So truthfully, this video will hit home if you've always known to trust your gut instinct, and vagus nerve function will allow you to do just that. So when we start getting into the nitty-gritty of this is really for moms who know in their gut, because honestly, trusting that mom gut instinct is the most important feature that you moms have. And so it's for you that know exactly that the health challenges, whether it's the gut, the immune system, behavior, and speech, and development, and learning, and all the big stuff there are all connected. And those that are really looking for a more natural approach without seeing multiple specialists and being prescribed unwanted medications. So you already know, go ahead and share this with moms and parents and people and providers who need to hear this absolutely the most. One of the biggest things that I've seen coming out of 2020 and 2021, we don't need to use the C word here, but is that COVID and post-COVID played such a large role on our autonomic nervous systems and primarily the function of the vagus nerve, whether it's the virus itself, whether it's the way that the stress load and inflammatory load impacted the body. You all probably know at least one person who is still today in 2024 struggling with long COVID or post-COVID type symptoms and issues. So the patient that I want to share with you guys today is it's a girl. She's about 13, 14, freshman in high school, by the name of Kendall. And so Kendall is a cool kid. Like all teenagers, there's the moods and the shifts and sleeping all the time and not interested in a whole bunch of stuff. And I've been trying to break through that within the office over the past couple months. But, mom found out about me through a friend of theirs and saying, because we address the nervous system, and because we can create better states of regulation within the nervous system, there's a lot of cool stuff that can happen. And so, what was interesting, and whenever I sat, nose to nose, knee to knee with Mom for the consult, she was like, this has really destroyed all of the cool things that she was into. So not only does she not have the energy or the fatigue, or the energy and is fatigued and just can't focus, is not able to do the things that she loved, like dancing or competitive orchestra and all of those things, it's really impacted her in a much bigger way. And so what was fascinating was, like, as we started moving through care, like, her sleep got a whole lot better. She was sleeping a ton already, but the quality of sleep that she was getting, and then you could watch, like, as her, like, mood would change from visit to visit to visit, she was more talkative, more expressive, making better eye contact, was more engaged in conversations with me. And, about a month and a half ago, so this was, like, in the middle of December, like, right before Christmas, Mom shared with me, or actually we were sitting in the office, she was about to get adjusted, and Mom was sitting there, she's like, did you tell him? And I was like, tell me what? Like, did you fail a test, or are you getting kicked out of school? Like, what's the deal? And, Mom was like, no, she had the idea on her own to get back to starting to dance. Not necessarily competitively, but starting dance again. And it's like, oh, like, that's a big deal. So not only, and this is something I actually talked with Mom about too, was because she would get these overstimulated, overstressed, almost PTSD like responses just thinking about going and doing a dance class or dancing or being in a dance studio, right? And it had happened several times leading up to that point. And so what Mom shared with me was like, look, like, this is the coolest thing to have ever happened, because I'm seeing my daughter come back online. And, like, when we start talking about vagus nerve disorders and the neurological regulation piece that we talked about on the last video earlier this week, that's the bigness of what it is that we do, is that the nervous system comes back online. We get the vagus nerve acting, which plays a role with socialization, emotional regulation, and digestive. And so when you start seeing those cool changes happen within these kids, it's almost like magic. It really is. It's almost like magic. But enough about that. We'll talk more about the vagus nerve. So, classically, when we started talking about the vagus nerve 5, 10, 15 years ago maybe, it was called the rest and digest nerve. Primarily because when it's functioning properly, it's the main contributor to the parasympathetic side of our nervous system, which, if we think about it, it's the opposite of the sympathetic nervous system, or that fight or flight response. So about 75%-ish of the vagus nerve tissue in your parasympathetic nervous system is actually the vagus nerve. And so that's a big deal. It makes up a lot of our parasympathetic side of the nervous system. So that's impacted. It wreaks havoc downstream in a whole lot of different places. And nowadays, when we really know that the vagus nerve goes well beyond rest and digest, it still does that, but it's responsible for the major portions of our immune function, our social engagement, emotional and behavioral regulation, and a whole lot more. And so what this really means is that unlocking and activating the vagus nerve and its functions could be the key to helping countless chronic health conditions improve without the use of dangerous, side effect producing, riddled drugs and medications. So let's first talk about what the vagus nerve can help with, and then we'll be able to explore how we can better help its function. So, when we talk about the research, because again, I'm all about research, I'm a big nerd when we start talking about it and getting into the nitty gritty, but research is showing us that the vagus nerve is crucial in helping regulate our mood, our emotions, and our behavior. And it's also key to regulating our immune system, especially when we talk about lowering inflammation within our gut, and it's because of its connection to the gut and the digestive system. So the vagus nerve is a big key connection to helping our brain and our bodily systems communicate and function with ease. And so, simply put, the vagus nerve can positively and negatively affect almost every single element of your health and your child's health. And so, as health starts with the basics, if you remember from our video from last week where we talked about developmental milestones and moving through development, we start with the foundation of eating, sleeping, pooping, and calming. And then our motor system, our immune system, communication and speech, and then emotional regulation begin to develop as well. And it's all built on top of the vagus nerve's ability to function and communicate clearly between the brain and the body. So usually the challenges with vagus nerve function stem from a previous infection, inflammation, physical, and even psychological stress. And as pediatric chiropractors, we see many vagus nerve struggles traced all the way back to birth trauma, such as prolonged labor or using instruments like forceps or vacuums during delivery, because these can potentially cause damage to the vagus nerve, especially because the vagus nerve is the most sensitive and susceptible area to trauma within our upper neck. And so when we start thinking about how normalized some of that birth trauma is, we can really start connecting the dots and the pieces of the puzzle together of like why so many babies are having trouble eating, sleeping, pooping, and regulating, moving into toddler years with the immune system issues, the behavioral and the emotional control, and then kids with so many other developmental issues. But I digress. And because it's hard for anyone to know exactly how past stressors or trauma impact the present, the big piece of that is that the first step that we take is to measure specifically what's going on within the nervous system, find out if it's off track, and then to determine how much it's impacted. And so the most important exam for this within our office is what's called heart rate variability. And so this is a simple 3-minute easy task that we run, and it tells us the activity and the balance within our nervous system. So are we so far off on this sympathetic gas pedal, or are we more within this parasympathetic exhaustion type state? And then how hard has our body been revving and running and gunning due to all of the stress? So I want to share with you kind of an example of what this looks like with a 2-year-old and what their heart rate variability test scan looked like. So I'm about to flip over my screen, share that with you, and we're going to go straight into it. Okay, so what you guys are seeing here is a heart rate variability scan. And so this is an example of a 2-year-old girl that was having vagus nerve challenges because sleep, digestion, gross motor control were all struggling pretty significantly. And so having such severe multi-system health challenges makes perfect sense with this HRV, especially where that small dot being that low from top to bottom and showing the autonomic index activity of this 54.89 means that her autonomic nervous system, or that automatic side of the nervous system, is exhausted and running on low battery. So let's get into the nitty-gritty of this. So when I'm looking at heart rate variability, essentially I'm looking at two things: the balance, so this is from left to right within our autonomic nervous system, and then we're looking at the activity within the autonomic nervous system, so from top to bottom. So ultimately, the goal with this is for this little white dot that you're seeing down there in zone 3, so shift it out to the left a little bit, but very, very down low, is we want this thing to be up through here. This is ideal and optimal vagus nerve function and autonomic nervous system regulation. So whenever I talk about heart rate variability with patients within the office, I want two big things. I want to see balance between the two sides, because if we're shifted off into the sympathetic side of it, which is out to the left, This is our big gas pedal stress stuck on subluxated side of the nervous system. And if we're shifted too far out into the right, this is more of our parasympathetic. So, we've talked about how the parasympathetic side of the nervous system is actually quite good. However, if we're shifted way, way out into exhaustion, which is where that starts to come about, we start getting levels of incoordination, disorganization, and confusion within the neurological system, simply because there's such a high level of exhaustion or a weakening, if you will, within that side of the nervous system. So, big thing is we don't want to be super, super stressed out, but we also don't want to be so downregulated that it's going to cover up symptoms. And honestly, over the past couple of years, this is what I'm seeing the most of within my practice is that kids are so down regulated and their body is pushing for recovery as best that it can that a lot of times these symptoms are masked and covered up because there's not enough gas in the tank and there's not enough energy to shift things forward and blow through some of it. So a lot of times what I'll see with these kiddos in those types of cases is that our gas tank may be quite low, meaning where we plot from top to bottom maybe a little bit lower. So this is what I call our gas tank or our reserves. So essentially, the lower that we plot reserves, the lower that we plot on this from top to bottom, the harder and the longer that our body and our nervous system has been working really, really hard. So our gas tank is empty the lower that we plot through here. And so the more shifted out into that left-hand side that we are, this is, this whole left-hand side, primarily the top part, is more significant active stress or acute stress onto the nervous system, like where, hey, we're real sympathetic, real fight or flight, real stress stuck on. And as the body starts staying in that state, is that it starts moving into in coordination of like, hey, we've been here for a really long time. Now I'm running out of gas. And ultimately, where we plot in through here, especially with this kiddo, gives me a solid idea as to what big type of hole that we really need to dig ourselves out of. So, how much more support do we need to give to the brain and nervous system to allow it to function exactly as it needs to? So, again, going back through this, the ultimate goal when we start talking about looking at this from a nervous system standpoint and the vagus nerve is that this big, green, happy, healthy, well adjusted, thriving area is the place for kids to be. And kids should not have stress onto the nervous system. If they do, we need to do something about it. Because you can throw all of the drugs and all the medications and all the supplements at this, and yeah, it may artificially stimulate or change heart rate variability to look positive, but because the stress on the nervous system is still there, you're really not going to be addressing the root cause. You're only going to be addressing it or covering it up with a band-aid, so to speak. So just because we're throwing supplements and we're throwing medication and we're throwing ice baths and all kinds of crazy cool biohacking stuff at this, we're really not going to be addressing as to why the problem's actually there in the first place. So uh, this honestly, heart rate variability is one of my favorite tests that we use within the office to be able to understand how deeply and how stuck the nervous system is and subluxated to this stress stuck onto the body. So, undoubtedly, the vagus nerve stands as a central figure when it comes to both pediatric and even adult health. So, from regulating digestion to shaping our emotional well being, its influence touches virtually every single aspect of our lives. And so, this is exactly why enhancing vagus nerve function is such a huge part of neurologically focused chiropractic care. And so, if you're intrigued by the vagus nerve's role in our health, or you suspect that you or your child are struggling with your vagus nerve's function, reach out to our office because we would love to discuss our clinical process and care planning that can help you all. So please leave any questions below, shoot us a DM, because we are always here to help. And on February 8th, we're going to be hosting our Perfect Storm workshop. And so this is a workshop for parents, for providers, for caretakers of kids struggling with gut and immune system issues, behavior, emotional regulation, learning challenges, or even big neurodevelopmental troubles like ADD, ADHD, or some of the complex neurological issues like seizures and autism. And so this is a free event for parents to come and watch and hang out and learn more about birth trauma, the vagus nerve, dysautonomia, subluxation, and all of the cool, fancy, nerdy terms that we've talked about over the last couple of videos to give you more information, give you hope that there is help for your child, and give you the action steps necessary to get your child the help that they need. So I will be looking forward to seeing you all on February 8th right here at Haven Family Chiropractic.